I would now like to introduce Shelly Yu. Shelly is a Parkinson's physiotherapist and a staff member at Parkinson's Society BC. She is trained in PD Warrior, Dance for PD, and Parkinson's Pilates. She is also the advocacy officer at the Canadian Physiotherapy Association's Global Health Division, which fights for healthcare equity in rural and suburban areas. I'll pass it over to Shelly now.
Hi, everyone. Hopefully you can all hear me and you can all see me. Thanks for the introduction, Alana. So it's great to be here today to talk to you about freezing. So the talk is titled today, Thawing Out Strategies to Reduce Freezing, pun intended. So today's talk, we're going to be discussing the who, what, where, when, hows of freezing, and talk a little bit about some of the difficulties with treating freezing, and hopefully give you some practical tips that you can take away in terms of what you can do to improve your freezing. Now, if you've been to my previous talks before, you'll know that I'm quite big on giving practical tips. And even though today's talk is heavily based on research, I'm not actually going to be diving too deeply into any specific research per se. But what you'll notice is during today's talk, there's going to be little numbers beside some statements, and those numbers refer to the references at the very end of the webinar. So if you are interested in reading some of the research behind any of the things that we talked about, that's what the numbers are for. And they're linked to specific papers at the back of the talk today, if you wanted to have a look. And I know that there are some health professionals in the webinar today as well, so welcome. And I hope that I can give you some tips or some ideas about what you can do in therapy sessions as well. Okay, well, without further ado, let's dive right in. If at any point you have questions, please feel free to ask throughout the webinar today in the chat box, like Alana mentioned. It's quite informal, so I can stop any point and discuss and answer any questions you might have. Okay. Oh, there we go.
Shelly, I just want to mention.
Yeah.
I just want to mention that your camera is not showing.
Oh, okay. Let me do that again. How about now?
I don't see it, but maybe others can type to see if they can see it.
Let me try that again.
Okay, so maybe it's just on my side because everybody else can see you.
Okay, well, as long as you can see me and you can hear me, that's great. Sorry about that, everybody. Okay, so let's dive right into our talk. Feel free to ask questions as we go along if you like. So, what is freezing? So freezing, the term currently that we use for definition is a brief episodic absence or marked reduction of forward progression of the feet despite intention to walk. I know it's quite a mouthful, but basically what it is when someone freezes, you'll see that the feet stay in one spot and they kind of do this trembling motion on the spot. Same with the legs, they tremble on the spot, and the upper torso, the body might propel forward, even though the feet are staying on one spot. So as you can imagine, freezing is quite a common cause for falls because of the feet staying on one spot and the upper body still propelling forward, even though the feet are stuck on one spot. And usually the freezing episodes usually last a few seconds, but it can be over 10 seconds as well, depending on the situation and the context of the freezing episode. But it actually affects quite a large portion of people, especially since at the early stages of Parkinson, it affects about 26% of people. And in the advanced stages, it tends to affect about 80% of people. So you can imagine already that because of the large proportion of people who do suffer from freezing, and because of the freezing being a common cause of falls, it can be quite a significant issue when it comes to discussing freezing and what we can do about freezing. Now, freezing is triggered by a variety of different reasons. So there's certain motor, cognitive, and environmental factors that can cause freezing. And it basically tends to happen in certain situations where you require quite a lot of divided attention, when you need to use your brain in terms of problem solving. And things like that, and interpreting different complex stimuli in the environment. So, for example, it might happen when you're turning, when you're going through a doorway, when you're approaching an obstacle or a destination such as like a chair. If you're about to sit down in a chair, it tends to happen a lot more often. And of course, we know that freezing can also be triggered and worsened by certain emotional situations. So if you're under time pressure to get somewhere, you tend to freeze more. If you're feeling stressed about the situation, or you feel embarrassed about freezing in a crowded environment, you also tend to freeze more. And ironically enough, freezing episodes, when you do freeze, you tend to have smaller shuffling steps, asymmetrical steps. And ironically, those things actually lead to freezing. So if you're walking in a room and you're feeling fine, you're not frozen, you're walking normally. But if you make yourself walk in smaller steps, in more shuffling steps, in more asymmetrical steps, quicker steps, you can actually trigger a freezing episode. So for that reason is why you see a lot of the times in therapy, we tend to work on taking bigger steps and more symmetrical steps. So if we talk about the reasons of why we freeze, well, oftentimes we think about freezing as a primarily physical problem. But actually, freezing is more a cognitive problem than a physical problem. While you're right in saying that, yes, there probably is physical issues that come with freezing, such as the quick, short steps, asymmetrical steps that we talked about. But actually, freezing is more due to a cognitive problem than anything else. So if we take the example of crossing a busy intersection, as you're crossing an intersection, there's lots of different conflicting stimuli that you need to pay attention to. So you'll need to be able to divide your attention between stop signs, traffic lights, watching out for cars that might be approaching, other pedestrians, cyclists, and all sorts of other things, potholes, curbs. So you'll need to have the ability to adapt and divide your attention between all these different types of stimuli. And you'll need to be able to switch your attention between concentrating on your posture, your walking, to listening for cars that are approaching, or watching out for traffic light changes. And you'll also need to be able to sustain your attention on a certain stimuli long enough for you to make a decision about what you're going to do next. So, for example, if you're about to cross the street, but you see a car approaching, you need to pay attention to the car itself to be able to determine how fast the car might be traveling, how far away it is, and make a decision about whether or not you think you'll be able to cross the street before the car comes across the intersection. And you also need to be able to selectively choose to pay attention to certain things while ignoring other things. So an example of this would be, again, if you're crossing the street and the pedestrian crosswalk is green, so it's giving you the go-ahead to cross the street, but you see a car approaching and you don't think it's going to stop anytime soon, so you decide to ignore the green light and stay where you are on the curb, and you wait for the car to pass. So all of these things, you're diverting and you're switching your attention, you're sustaining your attention, you're selectively choosing what to pay attention to as you're trying to cross this intersection. And not only do you need to pay attention to these things, but you also need to have the executive function of deciding, of acting physically towards these kind of decisions that you made. So whether you decide to physically go ahead or to stay on the curb and wait till the car to pass through. So you need to be able to inhibit certain inappropriate responses you might have when you're crossing the street, in the example that we talked about. And of course, there are some visual spatial function that you need to consider as well. So using our eyes to judge the height of a curb you're about to step off of, estimating how far away a car is, how quickly you think it's approaching, judging maybe the width of an obstacle on the street, like if there was a cone or another person or a pothole, judging the distance around these things to be able to determine how you can go about navigating these obstacles. So from all these things, you can see that that mobility takes a lot of cognition. It's not just the automatic response of you putting one foot in front of the other to walk, but it's also a lot of background processing in the brain that you don't notice that you're doing. And all of these things, the attention, the executive function, the visual spatial function, are all things that happen to be impaired in someone with Parkinson's. And so even though freezing itself is quite complicated in the sense that we still don't fully understand what pathways in the brain are actually affected with freezing, we do know things like attention, executive function, and visual spatial function are all impaired and are all affected, which can lead to freezing episodes. So with this already, you can imagine that if you were to be someone who attends rehab or therapy for freezing, if you were just doing physical activities all the time to, improve your balance or train the feet, yes, that might help you in terms of balance and taking bigger and more symmetrical steps, but it's not going to translate over into reducing your freezing episodes unless you also target the brain, unless you also target these attention, executive function, and visual spatial issues that come with freezing. And at this point, it's also important to note that there are some pharmacological considerations in terms of freezing of gait. So FOG here stands for freezing of gait. So there are some freezing episodes that are brought on by either not enough levodopa or too much levodopa, or sometimes freezing is not responsive to levodopa in general. Of course, I am by no means an expert in pharmacology, so if you did have any questions about medications and their interaction with freezing of gait, you can of course speak to your neurologist or your pharmacist as well. But I've just put that in here because there's more and more research out there that shows the different effects of medication with freezing, or the lack of effects of medication with freezing. Okay. So with all that said about the cognition side of things that affect freezing, why is it so hard to treat freezing? Even though we know that there are all these issues that affect freezing, and we talk about cues and all these things to help you temporarily reduce your freezing, but why is it so hard to actually get to the bottom of freezing and to fully treat freezing in a clinical setting? Well, we know that with freezing, there's already cognitive deficits. So you have issues with your cognition already when you're experiencing freezing. And for that reason, it's very difficult for you to learn new motor patterns or new strategies that might be able to help you overcome freezing, because cognition is already an issue. But also, even if you were to learn strategies such as cueing, so cueing would be things like using lines on the floor for you to step on, or using a metronome, like the beat of a music or something like that, to help you step in time to the music to overcome freezing. Even if you were to learn these cues, it's very difficult for you to actually deploy these strategies in a real life scenario because of the cognitive issues that come with people who are already experiencing freezing. And also, cues actually, the beneficial effects of cueing actually disappear over time when the cues are no longer novel. So when you've used the same cue over and over and over again, and you're so used to using that cue, you'll find that over time, the cue actually doesn't really work for you anymore, because when it's no longer a novel stimuli, when it's no longer a new thing, your brain switches over to sort of automatic pilot, and the automatic pilot in Parkinson's is what's not working. So when you've used the same cue over and over and over again, it might have been effective for a period of time, and then when you keep using the same one over and over again, it no longer has become effective. So that's another reason why freezing is so difficult to treat, so difficult to decrease, because of that cue decreasing in effectiveness over time. And of course, you'll find that the risk with treating freezing in a clinical setting is, of course, you need to be doing certain motor tasks and certain cognitive tasks to overcome freezing, and there's risk of falls that come with that. So for people who already experience freezing and who are already falling from freezing or near falling from freezing, you can imagine there's a lot of fear and anxiety and stress that comes with having to train the feet and the brain, and these emotions tend to make freezing worse. So the more you stress about freezing, the more you're scared about freezing, the more you think about freezing, the more frozen you get. And so for that reason is why a lot of the times when you are frozen, you'll hear people say, stay where you are, don't try to move anymore, take a deep breath, let's reset and start again. Because the more you worry about freezing, the more you stress about your current freezing episode, the worse the freezing itself actually gets. So with all this said, what can we actually do about freezing? So it's not all gloomy, even though I know the barriers seem like there's quite a lot there. It's not all gloomy. There's still lots of things that we can do. So there's a question here. Can you return to an old cue that has been stopped being effective and have it work? Yes, you can. So usually when cues stop working, so for example, if you were someone who used a visual cue, like lines on the floor maybe, and you're stepping on those lines to get the feet to go, if after using that for a while, it's no longer working, you can switch to a different cue like a metronome and use that for a while. And then when the metronome is no longer using, you can absolutely go back to a previous cue that has worked before, as long as enough time has passed that your brain and body is no longer remembering those cues per se, then yes, you can absolutely try them. So there are certain strategies where people choose 2 or 3 cues that work for them, whatever they may be. And they might cycle through the cues depending on when they're effective or when they're no longer effective. So you can definitely use that as well. And we'll actually talk a little bit about cues later on in the presentation to give you some ideas of certain things that you might be able to try, because not everyone's going to have the same cues that work for them. Some people will have different cues, and some people will use the same cues over and over again. So it really depends on who you are as a person, and we'll talk a little bit about that so we can get some ideas of what types of cues you might be able to use. So back to what we can do about freezing. Well, we know that taking smaller, quicker, more shuffling and asymmetrical steps can actually trigger a freezing episode. So we can try to rehabilitate that by getting you to take bigger, slower, and more symmetrical steps, especially for things like turning, because you can imagine as you turn, your steps are not symmetrical because one foot kind of stays on the spot and the other one steps more in order for you to do that turnaround step. So you can rehabilitate that by trying to get yourself to take bigger, slower, and more symmetrical steps as you're turning. So taking bigger arcs, for example. And we know that freezing is a result of having multiple cognitive, motor, environmental, and emotional stimuli. So when you have to multitask, when you have to problem solve, when you have to interpret lots of different stimuli in your environment. So we can simulate these environments by choosing certain things that make you freeze and trying to do them over and over and over again in a controlled environment in order for you to overcome those freezing episodes. And like we already mentioned, certain cues will stop working over time when they're no longer novel. So you can use different types of cues, or you can go back to an old cue that you haven't used in a while and sort of mix and match in that way. But of course, the main thing, the main takeaway message, I suppose, is that knowing that freezing is not a physical problem. Well, it is a physical problem because you are taking smaller and more asymmetrical steps, but freezing is mostly a cognitive problem. So in that sense, we need to actually be doing, obstacle agility courses, not just for the body, but for the mind as well. So you need to not only be doing physical things in rehab, but you need to actually train the mind to do these things as well. So such as diverting your attention, selectively choosing to pay attention to one stimuli, but ignoring another, and so on and so on. And in the next couple of slides, I'll be giving you some ideas and some examples for things that I use in clinical practice that have been quite effective. So you can try these things at home, or if you're a therapist, you can try these things in your clinical practice and see how they work. So So the first example of things you can do is simply just dual tasking. So dual tasking is basically when you're doing a physical activity, ideally a physical activity that takes some coordination or some thinking involved as well, but you're doing a physical task while also doing a cognitive task. So examples of this might be, for example, if you're doing a boxing combination, you might be doing a jab cross hook and then a rear uppercut or something like that. So there's a lot of components in the physical task already. It's not just, okay, we're going to repeat squats. That's pretty, automatic. You're not really thinking about it. You're just repeating squats. Whereas things like boxing, you're thinking a little bit more about the different combos you might be doing. And while you're doing these combos, you might be also doing a cognitive task, such as naming as many cities as you can think of, starting from the letter A all the way to Z. So A, you could say Auckland, and then B, you can say Birmingham, and then C, you can say Calgary, or something like that, where you're going from A to Z, and you're thinking about cities that start with the letter, and you're going from A all the way to Z. But of course, to make it more complicated, you can do the same thing in reverse, where you're going from the letter Z to A. And it doesn't always have to be cities. It could be anything else. It could be items you find in an office. It could be summertime activities. It can be ice cream flavors. It can be colors. It can be fruits and vegetables. So any categories at all, the more specific you are, the more thinking involved with thinking about the words that start from the letter A to Z or Z back to A. So that might be some things that you can try doing in your activities. But you can also do the same dual tasking activity by adding in numbers. And numbers tend to be a little bit more challenging for people. And you can think about doing a certain agility task, like walking around cones or navigating obstacles, where you're already kind of thinking about your physical task, but then you add a cognitive task on top of that. So maybe you're doing the agility task, you're walking around cones, and you're getting someone to count backwards from 100, but in numbers of 7. So for example, you would go 100, then you would go 93, then you would go 86, and so on and so on. So you're counting backwards in 7s from 100, or you can count backwards in 5s, or whatever else it may be. And you can even make it even more complicated by adding a certain math challenge, like someone shouting out math questions at you as you're doing these obstacle courses or stepping over certain obstacles. Like someone can say, okay, what's 13 plus 5 minus 2? Or, 2 minus 3 plus something else. So it can even go into the negatives of the numbers as well. So anything that makes you think while you're also doing a physical task that's already a little bit cognitively demanding is what I'm trying to get at. So if you were doing simply just sit to stands and dual tasking, that works as well, but it probably won't work as well as if you were to do a physical task that you have to already think about and then think about another cognitive task on top of that. Hopefully that makes sense. If there's any questions, please feel free to ask them in the chat box. Now, another example of certain agility or obstacle courses you can do for the body and mind is pictured here. So I know this picture is a little bit blurry, I'm sorry, but I took this picture over the weekend in my living room, and I was trying to make the numbers and letters big enough so you can see them. But basically, they're alphabet letters and numbers that are taped onto the floor. And the idea is you can tape numbers 1 to 10 and the letters A to J on the floor, and you want to be walking across the room, stepping on ascending numbers and ascending alphabets alternatively. So, for example, you would step on 1A, and then you would go to 2B, 3C, 4D, and so on and so on. And of course, you can imagine the further away you place the targets, the more of a challenge it is, because you have to step bigger. But also, you don't want the steps to just be right, left, right, left, right, left. But you'll see in the picture, sometimes you go right, left, and then sometimes you cross over, sometimes you step backwards. So that's kind of the idea with this kind of agility task, is not only are you doing a physical task that requires thinking because you're trying to aim for your foot to be on each of these targets, but you're also doing a cognitive task on top of it because you're thinking about, okay, ascending numbers, ascending alphabets, it's got to be 1A, then 2B, then 3C, and so on and so on. And if this gets too easy, you can, of course, add in any other elements. It doesn't just have to be numbers and alphabets, but you can add in other things. So you can add in Roman numerals even. So you can go 1A, I, Roman numeral 1, 2B, I, 3C, I, and et cetera, et cetera. And I've seen people do this with deck of cards as well, where you're doing ascending numbers, so 1, 2, 3, 4, 5, 6, 7, 8, etc. But you're also doing the suits of the cards. So, for example, you might decide to have a pattern. You would say, okay, clubs are first, followed by diamonds, followed by hearts, followed by spades. So you would step in that kind of order. So you would go to ace, clubs, and then you would then do diamonds and do hearts and do spades and so on and so on. So it doesn't just have to be numbers or alphabets. It could be anything else you decide. Of course, having numbers and alphabets is a little bit easier because the ascending numbers and ascending alphabets are relatively automatic. But when you start getting into patterns like playing card suits, those are not automatic. You don't automatically know that clubs come before diamonds or whatever. So you can add those components on to make it a little bit more challenging. Another idea for agility or obstacle course that you might be able to try is, again, doing a physical task of some sort while doing a cognitive task. So this one here, you'll see there are 4 pictures. So you can have cue cards made up and you write different colors on the cue cards. And the different colors are written in also different colors. So you can see here in the picture, on the bottom left, the card that says red, that is the only card that has the same color font as the actual word itself. So red is written in red, whereas if you look at the top left, you can see blue is written in green and not written in blue. And you can see the word green is written in orange and the word yellow is written in blue. So the idea of this, you can have various cue cards with these different colored words written on them in various color fonts. And you can get someone to do a physical task such as a multi-directional lunge, or maybe they're going through a physical obstacle course. And meanwhile, you're holding up these cue cards and you're getting the person to verbally say the color of the word. So not the actual word itself, but the color of the word that's popping up as quick as they can. So for example, if you look at the first row, the top left, it says blue, but the color is green. So you would say green. And then if you move over to the next one, you would say orange. And then the bottom one, you would say red. And then you would say blue. So you can see that it's a little bit more thinking involved because you're not saying the words that are coming up on the cue cards, but you're saying the color of the font of the words instead. So that's where it can get more confusing and you have to use your brain a little bit more. And this is an example of what we talked about earlier, where you're choosing to pay attention to one stimuli, but ignoring another. So you're choosing to pay attention to the color of the words written, but you're trying to ignore the actual words themselves. So you can imagine this can be quite a challenging task to do. Other examples of things that you might be able to do. You might be able to simulate an environment where you often get frozen. So for example, this is a picture of my house. You can see that there's a relatively narrow doorway and there's a narrow hallway. So if you are someone who gets frozen every time you walk down a certain hallway in your house or go towards a certain door, maybe you want to simulate that environment and try to practice those things by starting with a wider hallway of a similar length and maybe starting with a wider doorway and then slowly making them smaller and smaller as you go along. And you might be able to give yourself certain cues to help you with these things. Like when you're walking in the hallway, maybe you want to start by taping lines on the floor. And then as you get better at it, you can take away the lines on the floor and then start to make the hallway more narrow and more narrow. Or if it's through a doorway, again, you can tape a line on the threshold of the doorway so you can step over the line as a visual cue. And then as you get better at it, you take that away and just remember to always do that every time. But of course, you can use other strategies as well. For example, if no matter what you do, you're always frozen anyway, even if you try lines, even if you try visual, auditory cues, you tried everything and it still hasn't worked, then perhaps you can use a different strategy. Like every time you walk in a narrow hallway and you're frozen, rather than walking forward, maybe walk sideways. maybe walk on a diagonal. You can take backward steps if you want. Or if you're turning and you're always frozen, rather than turning on the spot, why don't you do a big arc, like a big U shape, in order to get to your destination? Or I think someone mentioned earlier as well that they always get frozen when they get to the stairs, when they get to the first step. So perhaps when you're walking to the step, you can think about lifting up your knees as high as you can, stomping on the floor. Imagine you're making that sound of stomping on the floor before you get to the first step. And every time you go up the stairs, stomp on each of the steps, etc., etc. So you can think of different ways to help you overcome these scenarios, but the idea here is you need to practice and simulate the scenarios that you feel frozen in order for it to be effective. I mean, you can practice these cues as much as you want, but if you don't simulate the environment, if you always do these cues in a big open space, it's probably not really going to help you when you get home and you're walking in the hallway that you always get frozen in. So always try to simulate the environment that you do find your issues are, and try to progressively work towards that specific scenario. So start with a wider hallway, slowly make it more and more narrow until you can do the narrow hallway at home. And of course, as you get better at this, you can, of course, add dual tasking to it as well. You can do these hallways or doorways or stairs or whatever it may be, while also, naming as many ice cream flavors as you can from the letters A all the way to Z, or do math problems or whatever else. Another example of certain agility or obstacle courses for the body and mind that you can do would be you doing either a walk or you doing a multi-directional lunge, where you either step forward, you can step sideways, you can step backwards, so multi-directional type stepping with both feet. And you can have somebody at home say to you, okay, forward, and then you would step forward. Backwards, and then you would step backwards. So kind of reactive stepping. So you're reacting to what the person is saying. So you're not just thinking, yeah, it's going to be forward, then it's going to be side, then it's going to be back, but it's going to be switched up, because the person giving you the cues will say different things and you're trying to react to them in your stepping. But of course, you can also make that more difficult, and you can react to what they're saying, but in the opposite direction. So for example, if somebody says, step forward, that actually means step backwards. If they say step backwards, they actually mean step forward. So you can make it opposite to what they say. And it gets even more complicated if they are starting to say right or left. So if they say right forward, they actually mean left backwards. Or if they say left side, they actually mean right side. And to make that even more complicated, you can add a number of steps. So you can say right 3 steps forward. And instead, that means left 3 steps backwards. Or you can say right 2 steps sideways. It actually means left 2 steps sideways. You can say left 4 steps backwards, but it really means right 4 steps forwards. And it doesn't just have to be for the feet when you're doing that. It could be for the arms. You can reach for certain things. So you can have different colors on the wall in front of you. So you could have a sticky note in red, a sticky note in blue, a sticky note in orange, and then someone can say right hand red, and you can touch the red one, or you can make the opposite. So whenever they say right hand red, they actually mean left hand red, and then right hand blue means left hand blue, and etc., etc. So you can imagine these are, you can see the pattern of these kind of agility or obstacle courses for the body and mind is when you're doing physical tasks that already required some thinking, but then you're adding another cognitive task on top of that in order to further challenge yourself. Now, earlier we mentioned about cues losing their positive effects the more you use them. And we talked about how you can sort of mix and match and find different cues that work for you, so that you always have something at the back of your pocket if you need to use them, if you know that one cue hasn't worked anymore and you need to find a new cue to use. Now, even though cues don't always work for everybody, I just thought it'd be still important to mention here the different types of cues you might be able to use and the different strategies you might be able to use to temporarily help you get rid of your freezing episode. So, of course, cues that you use, they're not going to be permanent. It's not like you used a cue once and then, your freezing's cured. But, of course, you can use cues in the moment, you're actually experiencing the freezing episode to help reduce the freezing episode or get rid of or help you temporarily overcome the freezing episode. So there are different visual cues, auditory cues, tactile cues, and imagery cues that you can use. In my experience, the most effective cues tend to be visual. Although, of course, if you're somebody who has vision issues or you have cataracts or something else, then perhaps visual cue is not as effective for you. But in my clinical practice, a lot of the people that I come across tend to have more of a better positive effect with visual cues or auditory cues, but it tends to be more visual. So examples of visual cues might be, like I mentioned, putting lines on the floor. So if you're walking in a hallway, maybe you're duct taping lines on the floor, so you always step to the lines. You have a visual cue of where you're putting your feet every time to help you take those big symmetrical steps that prevent the freezing episode from coming on. Or sometimes there are people with lasers on their walkers or canes. This is like a laser beam that you attach to the bottom of your cane or your walker. So every time you walk, you try to kick the laser or you step to the laser. You can practice stepping over a threshold. So if every time you're frozen in a doorway, maybe when you're in a doorway, you want to imagine the doorway, the bottom is quite raised and you want to take a big step over the obstacle. And auditory cues might be things like metronome. So using the tick, tick, tick of a metronome to step in time to. So every time it goes tick, 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 you're stepping tick, 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 and you're setting that beat for yourself so you can step in time with the metronome or in time with a music, with some piece of music that you're using. You can step to the beat of the music. Or might be somebody else or yourself physically, verbally saying 1, 2, 3, go, or they might say 1, 2, 3, step, or 1, 2, 3, stand, or something like that. And you can also use other auditory cues like right, left, in order to help you step, or you can go 1, 2, 1, 2 in order to help you with the stepping as well. Tactile cues would be things like, so it would be physical touch as a cue. So this one's a little bit more hit and miss, I find. It doesn't always work for everybody, but when it works really well. So for example, if you're experiencing your freezing episode and your feet are stuck on the spot and you just can't take that step forward, perhaps you or somebody else can touch you on the leg that you want to step forward with. So if you want to step forward with the right leg, maybe you or someone else touches your right leg and that helps you move that right leg forward. Or sometimes you're stuck on the spot and you just can't move anywhere and all these cues aren't working. You can actually get someone to touch you somewhere else that's not the leg, like the arm, your back, maybe your trunk, somewhere like that. And that touch stimuli itself can help you overcome the freezing as well, for the reason that you're now diverting your attention to the tactile response, and it helps you overcome that kind of autonomic stuck position that you're perpetuating yourself in that frozen episode. Okay, someone says here, how about getting out of a chair? I rock back and forth till I get enough speed to go, and then arms out to stop before I hit the wall. Okay, yeah, rocking is a good way as well. So what they mean here is using momentum, so that forward and backward propulsion to get yourself moving forward. That's absolutely fine if that works for you. So one thing to be cautious about is when you're doing the rocking forward, like you've already mentioned about the wall, usually when you do that rocking forward, you can't control it very well. So then as soon as you stand up, you tend to lean forward, and then you tend to sort of hit the wall, or you might fall forward. So that's the only thing to be a little bit cautious about. And actually for things like sit to stand, I would actually use something called imagery, which, well, I guess we're talking about now, but imagery. So you'll notice this a lot that we use, for example, in Dance for PD, uses a lot when you're getting someone from sitting to standing, you would use an imagery of some sort. So for example, you might be thinking about yourself as a plant, and your feet are firmly pressed on the ground. You're growing roots into the floor. You're extending upwards towards the sunshine. So that kind of that imagery of you growing up away from the ground, growing roots into the ground. So you're pushing into the ground as hard as you can as you stand up, head up to the ceiling. Or you might use things like imagine your body being a helium balloon and it's floating up towards the ceiling, something like like that would also help by using some kind of imagery that you can relate to. So it can't be an imagery that's totally far-fetched that you would never imagine, like if it was very specific to a certain sport or very specific to a certain scenario. But if it was something that involves everyday type objects that everybody can understand, then you can use that as a way to help you stand up. But of course, other imagery things you might be able to use might be if you're someone who's always frozen whenever you're turning. So no matter what you do, you're always just stuck. Even if you try to do a wide arc, even if you try sidestepping, nothing works. You're always stuck when you're turning. You can actually think about other types of imagery that might work. So first of all, when you're frozen, always stop what you're doing and just stand on the spot. Just stand there, take some deep breath, get yourself calm again. Because remember, when you're frozen on the spot, your emotions are high, you're feeling pretty anxious, you're scared about falling, you're really frustrated with yourself with not taking that step forward. And all those emotions can perpetuate the freezing even more. So it can make you even more frozen. So what you want to do is you want to stop what you're doing, stay on the spot, and just take a few deep breaths. You can, close your eyes. You can feel your feet grounding into the floor and just take some deep breath before you get going. And then if you're doing turning, you can imagine, after you've calmed yourself down, you can imagine, pretend you're a palm tree in Mexico, and somewhere sunny, you're a palm tree and you're swaying in the wind. So you're thinking about this idea where you're not lifting up the feet, you're not stepping anywhere, but you're thinking about the whole body swaying in the wind like a palm tree. So you're getting yourself to start to weight shift from leg to leg on the spot. You're not lifting your feet, you're not going anywhere, you're just weight shifting. And then when you get that weight shift, you make it bigger and bigger and bigger until you start to shift enough weight that each foot comes off, and then you start turning as a sway rather than a stepping turn like you normally would do. Maybe you turn in a sway instead. And it doesn't have to be a conventional, I must walk to turn, but it can be anything else. Anything that gets you to do the motor task that you want to do to get to your destination is absolutely fine. And sometimes you might be thinking also, if you're stuck in a doorway, you might be thinking about, okay, well, let's imagine I'm in a safari right now, and I want to step through, I want to stomp through some tall safari grass, or I want to, my feet are stuck in mud, I want to really lift them up with effort to get rid of the mud on my shoes, to lift my feet up and unstick them. So that would be examples as well. Okay, so someone says, frozen arm is a big problem for me. It seems to get progressive and needs physio and IMS just to get it moving. Can you be specific, and what therapy might help with this condition? Okay. So in terms of frozen arms, so a lot of times when people say frozen leg or frozen arm, it depends on what you mean, because from the sounds of it, if physio and IMS is helping, if IMS, so IMS is like a needling technique. If it helps, then it probably means it's more a rigidity issue. So maybe it's more stiff, so you can't move it, rather than a truly frozen issue. Because if it's truly frozen, in your arm even, because freezing doesn't just happen in the legs, it could be in the arm. So if you're trying to feed yourself and you're just, it just won't go anywhere, as soon as you pick up the spoon, it just won't go to your mouth. That kind of stuff is more when you're trembling on the spot and you're kind of doing this oscillating movement, tends to be that frozen episode that we're talking about, although it doesn't always need to be an oscillation, but that kind of, when you're doing a certain motor task, you're always frozen. That's more the freezing episode we're talking about. Whereas if it's just your arm is frozen in general, that's probably more a rigidity thing. Then certain stretches might be helpful. So if it's always your elbow, you might want to do stretches in the opposite direction. If it's your wrist, stretch in the opposite direction. So you might want to do lots of stretching, lots of mobility stuff where you can use your other arm to help you move your rigid arm in certain directions, to help the muscles not be so tight, and then it'll be easier for you to use. Whereas if it was actually a frozen episode, then you might want to think about doing these cueing type activities that we just talked about to help you alleviate the frozen episode then and there. But if you also want to do the agility and obstacle courses we talked about, you can do exactly the same thing, except rather than with the legs moving and you doing cognitive tasks, it might be your hands moving. So it might be things like you're picking up loose buttons and dropping them into an empty cup. And while you're doing that, you're doing the cue cards with the colored words on them, or you're doing some other cognitive tasks like naming as many cities as you can think of from the letters A to Z, or doing math problems or something like that. Or you can practice reaching towards something. So remember what we said earlier, where there's cue cards in front of you on the wall. There might be different colors. So there'll be red, blue, orange, yellow colored cue cards, and then someone goes right yellow, and then you touch the right yellow, or left blue, you touch the blue one with your left hand, and then you can switch that up and make it opposite. So whenever they go red blue, they actually mean left blue, and so on and so on. So all these things you can still do to help train the mind and the body, but of course cueing would be really effective to help you in that moment when you're actually frozen. Right? So doing cues when you're not frozen is not effective, because you don't really know if it's going to work or not, because you're not actually having the frozen episode. So cues are really only for when you are freezing, or when you're coming across to some environment you know you're going to be frozen in. So if you're approaching that doorway that you always get frozen in, you're approaching that staircase that you're always frozen in, you can use these cues to preemptively get your feet moving in that large symmetrical steps, so that you avoid the small, not symmetrical shuffling steps, which then bring on the freezing episode. I hope that makes sense. That was a bit of a long answer, sorry, but hopefully that all made sense. So someone wants me to explain what the laser cueing is and how does it work? Is it a device? Okay, so it's really simple. It's you know those laser pens that you can get from like the dollar store? That's basically it. It's like a laser pen, a laser beam. So the idea is you don't want the laser pens where you press on it, then the laser comes out, and then as soon as you let go, the laser goes away. You don't want those kinds, but you want a laser beam where you press it and then it stays on. So you press the laser and the laser beam stays on, like the green beam or the red or whatever. And the idea is you tape it to the bottom of, so you can duct tape it to the bottom of your walker, or the bottom of your cane, and then you turn it on so that when you're walking, there's always a laser that comes across in front of you. So you can imagine as you move the walker, the laser moves with it. So then the idea is every time you walk, you want to try to kick the laser or step on the laser. Or use the cane, same thing, step on the laser, and that helps you as a constant visual cue to keep making you step forward. So that's what the laser is. It doesn't have to be expensive, literally a laser pen, a laser cat toy, although it has to be a laser beam rather than a single point, if that makes sense. If you turn it on and it's just a laser point on the wall, that's not really going to be effective because you don't see the beam. You want the laser beam so you can step on. Okay, and someone else says, freeze crossing the road. My workmates would carry me to the curb and stay with me. Very nice. Oh, okay. Well, that's very nice. Yeah, absolutely. So you have someone help you to the curb and you stay there. I think the issue with crossing roads and that being a freezing triggering type episode is because of, like we mentioned earlier, with the multiple stimulation. There's so much going on. There's so many stimuli for you to interpret. And the anxiety of crossing the road and not getting hit by a car is also part of the reason why a lot of people freeze. But you can try to train yourself in those environments by trying to walk in busy environments that are safe, like maybe the mall you want to try walking in, or Superstore, Save on Foods, you know, those kind of stores that tend to be a little bit busy. And you can try to walk around the store first at a time that's less busy, out of rush hour. So like first thing in the morning or something like that, or during the day when everybody's at work and the stores are a little bit more quiet. And then you work your way up to peak hours in the store. And sometimes that would be helpful as well. Will lasers on walkers lose their effectiveness over the long run to trigger movement? The answer is yes, because like all cues, any cues that you use, they tend to lose effects over time when your body is really used to it and your brain is used to it. It's like an automatic thing that you just do. So anytime your brain switches from actively paying attention to the cue to being automatically letting them run on autopilot, that's when the cues lose their effectiveness, because the autopilot portion of the brain don't work. So like I mentioned before, you can start with a laser and have that work, but then when it stops working, you can use other things like listen to music when you're walking, listen to a metronome beat when you're walking, or something like that as well. Can DBS help with freezing? Okay, the answer is yes and no. And the reason I say that is because there are more and more research out there that actually show that DBS don't help with freezing. But again, it depends on who you are and what kind of freezing episodes you have. So generally, DBS don't help with freezing, but of course, I am by no means an expert in DBS, so I would talk to a neurologist about that. But there are more and more research coming up that show they don't help with freezing. How do you deal with crowds if you can't avoid them? Yeah, you're absolutely right. And some of the ways that you might be able to deal with crowds, of course, in a safe environment. So if you were to train yourself in a crowd in a supermarket, some people might like to dampen down their stimulation first. So for example, if crowds are a huge thing for you, maybe you want to wear some sort of earplugs when you're in the store and you're practicing, so it decreases that auditory stimuli that you have to then interpret. Or some people wear hats, baseball hats with a little beam on top, just so you can kind of you can kind of sift out some visual information because it's blocked from you. So you can do certain things like that where you dampen down the stimulation in order to decrease the amount of cognitive demand on your brain. But of course, if you can find cues that work for you in a crowd, even better. So if you're crossing the street on a zebra crossing, maybe you want to step on each of those zebra lines. That might help. Or if you have someone cross with you, every time you're frozen, maybe they tap you on the leg or they touch you on the arm, using some kind of tactile feedback, or it might be music that you're listening to every time you need to do something. That might be ways to go about it, but you're absolutely right. You can't really avoid crowds per se, but you can try to simulate the crowded environment and train yourself up to be able to dealing with large crowds. Okay, what can help freezing if not able to roll up from bed in the middle of the night to washroom? Okay, so for things like rolling, if you find rolling is the main issue for you, well, first of all, I would say if bed mobility is an issue for you, you first want to be doing lots of stretches for your trunk and body. So you can be lying in bed, drop your knees to one side. So you're stretching your back in a rotation, because remember, we talked about freezing and some rigidity can sometimes go hand in hand. So you want to try to stretch and keep yourself as mobile as possible. But of course, if you're having issues rolling, then again, maybe you want to use a visual cue, such as if you have a bed rail that you use, you put it up and you try to reach for the bed rail with one of your arms, or you try to reach your knees and the arm towards the bed rail. Or you might want to use imagery, like you want to imagine you're a canoe on the river and it's rocking side to side. So you might want to think about that, where you start really small movement, you rock side to side like a canoe, and then as you get more movement, you start rocking bigger and bigger and bigger until you can use momentum to swing to one side. So you can use the exact same types of cue to help you with that as well. And as you get better at that, you can even train in an agility type, the agility obstacle course, because remember, the agility and obstacle course, you can adapt it to anything at all that you have issues with. So maybe you're lying down, your knees are up and your arms are sideways like this, your knees are up, and you want to roll your knees to one side, and then you want to clap your hands to the other side. That kind of stuff would work as well. Maybe you want to do that physical task at your own pace while also doing a cognitive task, like a dual tasking situation as well. Hopefully that makes sense. So you can do anything like that to help. Okay, and someone says, okay, great. I'm glad this can help in terms of your Parkinson's exercise. Great. Someone also says, I had DBS last year, and unfortunately, it caused me to have freezing and frequent falls. Yeah. So, so like I mentioned earlier, DBS doesn't always help with freezing, and there's more and more evidence out there that DBS can sometimes worsen freezing, or just not have an effect in general on freezing specifically. Okay, someone else says, I tend to close my eyes often, especially my left eye, and I have a problem opening it at once. Is this type of freezing? Okay, yeah. So that's a really good question, because freezing isn't always just the legs. It can be your arms. It can be sometimes your speech a little bit. It can be anything, any kind of motor activity that you need to do while also thinking about something else tend to make you freeze. So remember, freezing is, so with Parkinson's, for some reason, when you have to do a cognitive task and a physical task, the physical task always deteriorates. always. So it's always, you always prioritize the cognitive task over the physical task, hence why for the freezing, when you're walking, hand when you're feeding, that kind of stuff. So if it was your eye and it wasn't a different issue, so if it was just the eye and it was getting frozen, you can try using certain cues to help overcome that as well. So for example, if your eye is always closed, you can maybe do something else. You can distract yourself by doing other things, like maybe scrunch up your eyes, scrunch up your nose, and then think about opening them as wide as you can as a way to help overcome that. So distracting, doing something else by squeezing first and then opening. Or you can also use metronomes. You can use music. It sounds a little bit silly, but you can use music and metronome and try to go, okay, and then you try to open with the music and then maybe close on the next beat, and then open on the next beat, close on the next beat, and so on and so on. You can use tactile feedback as well. So if your eye is really stuck, maybe you want to give yourself a gentle little tap on your eye, a little rub, or you can tap somewhere else on yourself to help overcome that kind of being stuck in the automatic pilot that's not working. So that kind of comes on to my next point about the other strategies on the slide. So if all of these visual, auditory, tactile imagery, all these things are not working, you might want to think about other strategies that can work. So if you were in a hallway and you were getting stuck and your feet aren't going anywhere, change directions. Rather than going forwards, can you go sideways? Maybe you can shift weight on the spot, kind of like the palm tree that we talked about, shift weight on the spot. Don't think about walking, just think about rocking on the spot. And then as you get more and more weight shift, then you can start the walking. Or maybe you want to move another part of the body to distract yourself. So rather than keep trying to make the feet go forward when they're not going anywhere, stop where you are. See if you can do a couple of arm swings. Can you do a couple of trunk rotations? Can you do a couple of shoulder taps or something else? And then start to get moving again. So in summary, freezing, as you can see, is quite a complex issue. It's not a physical, well, it is a physical issue, but it's also a cognitive issue. So you can train yourself physically until you're blue in the face, but that's probably not going to be the most effective as if you were to train cognition at the same time. And we know that freezing episodes are triggered by various motor, cognitive, environmental, emotional factors. So it tends to happen in a time where you need to selectively divert your attention to multiple things at once, or you need to problem solve. And when these things do happen, cueing might be effective in temporarily reducing or getting rid of that freezing episode you're experiencing, but the effects deteriorate over time. So you can't just rely on cueing. You might want to think about training the cognition as well, or switching up the cues so they always remain a bit novel. And of course, you can use obstacle or agility courses to help train both the mind and body and reduce these freezing episodes. Now, someone already asked, do you know anyone offering classes to reduce freezing specifically? The answer is no. There are lots of Parkinson's classes out there, but, and they do various dual tasking type things, but I don't think anybody advertises just purely freezing class. But with that said, we do have a freezing exercise series coming out that I'm actually doing in October through PSBC. So if you are interested in seeing what kind of freezing exercises you might be able to do, you can join in on those classes. Of course, being a virtual class and everybody having different equipment at home or not equipment at home, it's not going to be as robust as I would like it to be, but it gives you an idea of the types of exercises you might want to be doing to help with freezing. It won't be as great as having the obstacle courses in person and the cue cards in person, but it gives you an idea. So if you're interested in seeing what kind of exercise you might want to do in terms of freezing exercise class, you can feel free to sign up for the October freezing exercise series, and you can see how it goes. Okay, so this is me, Shelly Yu. If you want to contact me about any specific questions, you can reach me at my Parkinson's email, syu@parkinson.bc.ca, or equally, I also do have a private practice. Of course, that's conflict of interest, but I do need to mention it as a conflict of interest anyway. I do work at Neurofunction Rehab or Life Skills Therapy. They're a sister company in the Lower Mainland in Surrey, BC. You can contact me on there too if you would like to have any advice on specific questions that you may have. Okay, I see a question here. Can a diet help with freezing of gait, keto, meatless? That's a very good question, and we do often get questions about nutrition. I don't know of any specific nutritional regimes that would be helping with freezing of gait that is robust in evidence. So I don't know any robust research papers that have come out with nutrition, but there are some speculations about anti-inflammatory type nutritional regime might help with certain things in terms of freezing or any cognitive deficits, but I don't know for sure whether that's actually based on evidence or not. I know that there's lots of talk about that, but I don't know whether it's robust in evidence, so I wouldn't be able to give you any advice on that. Someone says, I took up badminton to help with freezing and leg movements helped hire a coach. Yeah, perfect. So any kind of physical activities that's hand-eye coordination would be really great as well. I know we're running out of time. I'm so sorry. I tried to condense this topic as much as I can in the hour. Hopefully that was helpful. If you do have questions, you can feel free to drop me an email. The contact email is at the top of the chat box as well, if you would like. And if you are interested in reading all the research papers out there and go down a wonderful rabbit hole about the topic of freezing, I do have reference lists here. Of course, this session is recorded and the slides will be uploaded onto the website. So if you did want to have a look, you can follow us on our website or on our YouTube channel, and you can review some of these things. Thank you very much, everybody. Hopefully that was helpful. I'll go back to my contact page in case you want to contact me, but do let me know if you have any questions or anything specific that you would like to know. Thanks, everyone.
Thanks, Shelly. Some really excellent practical strategies that you provided to help with freezing. So thank you so much for the talk, and thank you everyone for attending. And yeah, like Shelly said, if you didn't have your question answered, feel free to email her. Thanks so much. Bye-bye.
Thanks, everyone. Bye.